Thank you, Honorable Deputy Speaker, sir. Sir, I would like to express my sincere thanks to Honorable Member from Umsning, Dr. Celestine Lingdo, for bringing up this issue, a resolution which says this House do now resolve to constitute an inquiry commission to study the manner of implementation of Jal Jeevan Mission in the state of Meghalaya. Sir, I prepared a lengthy answer for this and it will take some time, so I would request all the honorable members to have a patience with me. Some of the points I have already mentioned in my last reply to the short duration discussion with regard to this Jal Jeevan Mission. However, for better understanding of the honorable members in this August House, I will be repeating the same. Sir, it goes like this. Accessibility to safe water in adequate quantity and quality with good sanitation practice is the foundation of good public health and consequently leads to a better standard of living as people can concentrate on more economically productive activities instead of wasting time and energy in carrying out to their homes. In this backdrop, Jal Jeevan Mission was launched by the Government of India in partnership with the states, which aims at providing functional household tap connections, FHTC, to every rural household by 2024. PHE department is earnestly implementing this highly ambitious program for time-bound completion of JJM. Under JJM, the priority was accorded to those villages where there are fewer of water supply insufficient to meet the prescribed minimum quantity of 55 LPCD or more for taking up retrofitting works, that is converting public stand posts to functional household tap connections. Next priority was accorded to those villages where pipe water supply scheme exists, but level of supply is inadequate to provide 55 LPCD of water by taking up augmentation. The last category were the villages where no pipe water supply schemes had been taken up earlier and require new pipe water supply schemes for providing FHTCs. For implementation of rural supply schemes, Department follows the guideline issued by the Government of India, Ministry of Jal Shakti and other instructions issued by the Ministry from time to time. The implementation of Jal Jeevan Mission in the Meghalaya transcends mere infrastructure development by not only providing FHTCs to all the rural households in the state, schools and Anganwadi centers, but also about ensuring the assets created under JJM is sustained. There are 6,470 villages in the state with a total of 6,51,412 number of households targeted for providing functional household tap connections. The department has achieved significant milestones by providing functional household tap connections to 100% household in 3,156 number of villages, out of which 2,012 number of villages has been reported as Har Ghar Jal. Sir, this Har Ghar Jal is certified by the BWSCs. They have a meeting in the village and only when the villagers are satisfied, this is given. In addition to these 4,84,927 functional household tap connections that have been provided up to 18/2/2024, 9,422 schools and 3,625 Anganwadi centers have also been provided with water supply. Funding pattern under JJM for the northeastern states like Meghalaya is 90:10, where 90% of the cost of the project schemes is borne by the center and 10% is borne by the state. In addition, the beneficiaries are required to contribute 5% of the in-village infrastructure cost in cash/kind/labor. The state plan outlay under rural water supply sector is being utilized for meeting the state share of JJM. Under the JJM, in compliance with the operational guidelines, the schemes were prepared by the respective divisions in consultation with the village water supply committees, that is VWSCs, reviewed by the District Water and Sanitation Commission, DWSM, and approved by the state level schemes sanctioning committee. Ministry of Jal Shakti have delegated power for giving technical and administrative approval of JJM schemes to the state government after the schemes proposed under the program JJM are cleared and approved by the state level schemes sanctioning committee. Schemes technically approved at the directorate level are placed before the SSLC for clearance and approval. The state level scheme sanctioning committee is constituted by the government in PHE department and is headed by the secretary in charge of PHE department as chairman, with the chief engineer PHE as member secretary and representative of Ministry of Jal Shakti, Central Water Commission, Central Groundwater Board, Health and Family Welfare Department, Planning Department, Finance Department, etc. as members, thereby ensuring multi-stakeholder engagement and decision-making processes. Once the schemes are cleared by the state-level sanctioning committee and the state-empowered sanctioning committee, administrative approvals are issued thereafter by the government in PHE department. The scale and size of JJM schemes implemented for providing domestic water supply in the state of Meghalaya is unprecedented, and the project for every village is tailored, met as survey. Designs, drawings and estimates had to be carried out individually for every village in the state due to the geographical terrain of Meghalaya. More than 4,000 of such DPRs were prepared by PHE engineers in consultation with local communities in a bottom-up approach, which were uniquely customized to suit local requirements and topography. This was a Herculean task taken up by PHE department with limited manpower, and the department has the time constraint under JJM. To implement this, one point I would like to mention here is that PHE department with current manpower, without any additional manpower given to the department, this huge project has been implemented. Altogether, 4,060 numbers water supply schemes amounting to 6,645.633 crores to cover 6,03,048 functional household tap connections were cleared by the state level sanctioning committee under JJM since 2019 till February 2023. The district-wise breakup of villages and number of households and population is here as follows. Number 1, East Garo Hills, 3 blocks, 501 villages, 744 habitations, 39,952 households, 2,11,529 population. Number 2, East Jaintia Hills, 2 blocks, 189 villages, 232 habitations, 25,857 households, 1,66,019 population. 3, East Khasi Hills, 11 blocks, 925 villages, 1,413 habitations, 1,39,849 households, 7,47,948 population. Number 4, Eastern West Khasi Hills, 2 blocks, 201 villages, 331 habitations, 30,092 households, 1,70,860 population. 5th, North Garo Hills, 4 blocks, 568 villages, 640 habitations, 41,088 households, 2,11,734 populations. Sixth, Revoid, 4 blocks, 584 villages, 1,123 habitations, 63,025 households, 3,33,476 population. South Garo Hills, 4 blocks, 752 villages, 985 habitations, 37,948 households, 2,13,614 populations. Seven, South Garo Hills, 4 blocks, 752 villages, 985 habitations, 37,948 households, 2,13,614 populations. 8, Southwest Garo Hills, 3 blocks, 471 villages, 945 habitations, 47,891 households, 2,32,153 populations. 9th, Southwest Khasi Hills, 2 blocks, 295 villages, 478 habitations, 21,816 households, 1,28,445 populations. 10th, West Garo Hills, 8 blocks, 1,095 villages, 1,847 habitations, 1,10,954 households, 5,65,642 populations. West Zantia Hills, 3 blocks, 302 villages, 418 habitations, 58,072 households, 3,75,446 population. West Zantia Hills, 3 blocks, West Khasi Hills, 2 blocks, 587 villages, 658 habitations, 34,868 households, 2,27,432 populations. Total 48 blocks in the state of Meghalaya and 6,470 villages, 9,814 habitations, 6,51,412 households, 35,84,298 populations. District-wise progress of FHTC under JJM is as follows. Number 1, East Garo Hills, total rural household as on 1/4/2023, 39,952. Household connections with FHTC as on 15/8/2019, 18. Total household connections reported as on 18/2/2024, 33,988. Percentage 85.07. Southwest Garo Hills, total rural household as on 1/4/2023, 47,891. Total household connections with FHTC as on 15/8/2019, 697. Total household connections reported as on 18/2/2024, 40,619. Percentage 84.82%. Eastern West Khasi Hills, total rural household as on 1/4/2023, 30,092. Household connections with FHTCs as on 15/8/2019, 0. Total household connections reported as on 18/2/2024, 25,084. Percentage 83.36%. North Garo Hills, total rural household as on 1/4/2023, 41,088. Household connections with FHTCs as on 15/8/2019, 20. Total household connections with reported as on 18/2/2024, 33,425. Percentage 81.35%. South Godavari Hills. Total rural household as on 1/4/2023, 37,948. Household connections with FHTCs as on 15/8/2019, 22. Total household connections with FHTC reported as on 18/2/2024, 30,699. Percentage 80.9%. Riboy. Total rural household as on 1/4/2023, 63,025. Household connections with FHTCs as on 15/8/2019, 6. Total household connections reported as on 18/2/2024, 50,978. Percentage 80.89%. West Khasi Hills District. Total rural household as on 1/4/2023, 34,868. Household connections with FHTCs as on 15/8/2019, 130. Total household connections reported as on 18/2/2024, 26,946. Percentage 77.28%. Southwest Khasi Hills. Total rural household as on 1/4/2023, 21,816. Household connections with FHTC as on 15/8/2019, 13. Total household connections with FHTC as on 18/2/2024, 15,954. Percentage 73.13%. West Garo Hills. Total rural household as on 1/4/2023, 1,10,954. Household connections with FHTC as on 15/8/2019, 507. Total household connections reported as on 18/2/2024, 79,396. Percentage 71.5%, 56%. West Jantia Hills. Total rural household as on 1/4/2023, 58,072. Household connections with FHTC as on 15/8/2019, 45. Total household connections with FHTC as on 18/2/2024, 40,016. Percentage 68.91%. East Khasi Hills. Total rural household as on 1/4/2023, 1,39,849. Household connections with FHTC as on 15/8/2019, 3,085. Total household connections reported as on 18/2/2024, 94,527. Percentage 67.59%. East Jantia Hills. Total rural household as on 1/4/2023, 25,857. Household connections with FHTCs as on 15/8/2019, 7. Total household connections reported as on 18/2/2024, 14,295. Percentage 55.28%. Total for entire state of Meghalaya. Total rural household as on 1/4/2023, 6,51,412. Household connections with FHTCs as on 15/8/2019, 4,550. Total connections reported as on 18/2/2024, 4,85,927. Percentage 74.60. The release of central share of JJM fund is guided by number of factors, that is release of matching state share, outcome in terms of FHTC utilization of available funds, geotagging of scheme information boards, etc. Jal Jeevan Mission in Meghalaya exemplifies a holistic approach towards sustainable water management. with a strong emphasis on community participation, empowerment, and capacity building. Several initiatives have been undertaken to foster proactive involvement by the local population, instilling a sense of ownership and responsibility towards water resources. Activities such as information, education, and communication, that is IEC, campaigns, training programs, mobilization efforts have been initiated to promote community involvement in JJM. Participatory rural appraisal techniques like water resource mapping and water budgeting facilitate collaborative identification of challenges and development of action plans for sustainable water sources. Innovative campaigns like water guardians, strengthening sustainable communities, acknowledge and award villages for exemplary water conservation efforts, fostering a culture of responsibility towards water resources. The Water Smart Kids initiative empowers young minds with knowledge and practical skills, cultivating environmentally conscious individuals, contributing to water conservation endeavors. Under the Jal Jeevan Mission, implementation support agencies play a crucial role in mobilization and engaging communities to ensure the successful planning, implementation, management, operation, and maintenance of in-village water supply infrastructure in Meghalaya. Implementation support agencies, that is ISAs, have been empaneled in Meghalaya to serve as crucial facilitators in successful execution and sustainability of water supplies infrastructure projects under the Jal Jeevan Mission. They conduct mobilization campaigns to raise awareness among community members about the importance of water supply projects. They organize meetings, workshops, and outreach events to engage residents and encourage their participation in project activities. ISAs also encourage community members to take ownership of water supply infrastructure and contribute to its maintenance. Initially, the department empaneled 2 agencies in 6 districts to cover villages without pipe water supplies. The empaneled agencies are Kalpataru Garmodyog Samiti Bhopal and Agency for Sustainable Development Initiative KJP Sinot Sengi Shillong. However, given the extensive scope of work, the geographical spread, and the time constraints involved in implementing water supply projects under the Jal Jeevan Mission in Meghalaya, the Public Health Engineering Department has taken proactive measures to enhance implementation efficiency. One such measure is the signing of a Memorandum of Understanding with the Meghalaya State Rural Livelihood Society, that is MSRLS, to engage cluster level federation and village organization as empaneled implementation support agencies in 4,850 villages across the state. This strategic collaboration with MSRLS underscores a commitment to leveraging existing community structures and resources to streamline project implementation and enhance local participation. By involving cluster level federations and village organizations as ISAs, the department aims to A. Leverage local expertise. Cluster level federations and village organizations possess valuable local knowledge and insights, which can be instrumental in ensuring project alignment with community needs and priorities. B. Facilitate community ownership. Empowering local organizations to play a central role in project implementation fosters a sense of ownership and responsibility among community members, thereby increasing the likelihood of project success and sustainability. C. Optimize resource utilization. Engaging existing community structures as ISS allows for optimal utilization of resources, both human and financial, minimizing duplication of efforts and maximizing project impact. D. enhance outreach and mobilization, leveraging cluster level federations and village organizations as IAS facilitates effective outreach and mobilization efforts, ensuring broad community engagement and participation throughout the project life cycle. Overall, the collaboration between the Public Health Engineering Department and MSRLS represents a proactive and strategic approach to overcoming implementation challenges and accelerating progress towards achieving the goals of the Jal Jeevan Mission in Meghalaya. By harnessing the collective strength and expertise of local organizations, this partnership aims to enhance the effectiveness, efficiency, and sustainability of water supply projects, ultimately improving the quality of life for rural communities across the state. Comprehensive training programs are conducted to enhance the capabilities of various stakeholders involved in JJM implementation. Recently, a memorandum of understanding was signed between the Public Health Engineering and the State Institute of Rural Development, that is SIRD, for enhancing capacity building initiatives at the grassroots level in Meghalaya. The collaboration with SIRD allows for focused capacity building initiatives targeted at VWSCs and other grassroots level stakeholders. These communities play a pivotal role in the planning, implementation, and management of water supply projects, making their capacity building essential for project successes and sustainability. Honorable Deputy Speaker, sir, capacity building initiatives led by SIRD empower grassroots leaders and stakeholders with the knowledge, skills, and confidence needed to effectively participate in decision-making processes and project implementation activities. This helps strengthen local governance structures and fosters community ownership of water supply infrastructure by equipping VWSs with necessary capacity and skills. So far, 2,038 VWCs members have been trained. By leveraging the expertise of SIRD as an empanel agency, stakeholders receive high-quality training and support that is specifically tailored to their needs and context. This ensures that capacity building efforts are relevant, effective, and aligned with the objectives of JJM. Skilled manpower plays a crucial role in ensuring the efficient operation and maintenance of water supply infrastructure, thereby contributing to the longevity and effectiveness of such systems. The PHE department in Meghalaya has recognized the importance of skilled personnel and has implemented various training programs and aimed at developing the necessary skills among individuals involved in the operation and maintenance of water supply infrastructure. This includes training in trades such as plumbing, masonry, pump operation, electrical work, motor mechanics, and multi-skilling, ensuring that personnel are equipped with necessary expertise to effectively manage water supply infrastructure. A total of 6,295 individuals have been trained through these programs, reflecting the substantial impact of the department's efforts in capacity building. Sir, the introduction of the Nal Jal Mitra program by the central government also presents an opportunity for further expansion of skill development initiative in the state. The proposed training of additional 6,500 individuals through this program demonstrate the commitment to continuously enhance the skills and capabilities of personnel involved in water supply operations and maintenance in building a competent and capable workforce of effectively managing water supply infrastructure in Meghalaya. Honorable Deputy Speaker, sir, the department is also planning to implement IoT monitoring system as a pilot project in 11 locations in the state to monitor the water, to monitor the quantity and quality of water such as pH level, turbidity, and residual chlorine in real time using various sensors to know the live water quality status of water. This will enhance the success rate of water supply schemes due to end-to-end visibility of water supply and equitable access to safe water for all sections of the society, which will benefit all stakeholders across multiple dimensions like economic, social, environmental, health and safety. Honorable Deputy Speaker, sir, by integrating these strategies, Meghalaya's JJM endeavors to foster a sustainable water management ecosystem characterized by the community participation, empowerment and technological innovation. These initiatives not only ensure the long-term service delivery of water supply schemes, but also contribute to overall well-being and prosperity of rural communities across the state. Under Jal Jeevan Mission, third-party inspections, that is TPIAS, have been empaneled for ensuring successful execution of water supply projects. Third-party inspection agencies, that is TPIAS, serve as integral entities within the framework of Jal Jeevan Mission in Meghalaya. Their primary functions revolve around ensuring the quality and timely completion of water supply projects, thus upholding the mission's objective of delivering safe and sustainable drinking water to rural communities. Engaged across all districts, third-party inspection agencies assume a vital role in oversight and supervision of project execution. Their responsibilities encompasses independent inspections, meticulous monitoring of progress, and meticulous verification of compliance with prescribed project specifications and guidelines. This comprehensive oversight extends to all facets of engineering works, including civil, mechanical, and electrical components, ensuring adherence to standards and best practices. One of the paramount contributions of TPIS, third-party inspection agencies, lies in their role as a guardians of transparency, accountability, and efficiency within the JJM implementation framework. By conducting thorough inspections and assessments before authorizing any disbursement of funds to executing agencies, third-party inspection agencies serve as a bulwarks against potential lapses or discrepancies in project execution. Payment of works under JJM is through Public Finance Management System, that is PFMS, after due verification and recommendation by third-party inspection agencies. Ensuring that water quality is as per prescribed norms is very important, and water quality monitoring and surveillance is one of the important components under the Jal Jeevan Mission. Water quality monitoring and surveillance envisions to facilitate the provision of clean tap water supply to every rural home and public institution, ensuring testing and monitoring of drinking water supply and sources by PHE department, and regular water quality surveillance by community to have confidence in consuming water directly from the tap. Water quality and management and surveillance is divided into two parts, which include water quality monitoring and water quality surveillance. Honorable Deputy Speaker, sir, water quality monitoring is done by PHE department to supply safe water as per the BIS specifications of IS, that is 10500/20/2012. This involves the testing of water samples through the laboratories, which are the backbone of monitoring activities. Testing through laboratories is done at least once a year for chemical contamination and twice a year for bacteriological contamination, which is as per the operational guidelines of Jal Jeevan Mission. The PHE department, Government of Meghalaya, has one state laboratory which has accredited by the National Accreditation Board for Testing and Calibration Laboratories, NABL. In the field of water testing for both chemical and biological disciplines, in accordance to ISO/IEC 172025 is to 2017. 12 district level laboratories, out of which 3 are NABL accredited, and 18 subdivisional level laboratories across the state. The number of parameters which are analyzed in PHE department laboratories are as per scope of testing for chemical, biological discipline are 14 parameters in the state lab, 12 parameters in district lab, and 10 parameters in subdivisional lab. The parameters which are analyzed for water quality include color, odor, turbidity, pH, TDS, total alkalinity, total hardness, iron, chloride, free residual chlorine, nitrate, sulfate, E. coli, and coliform. Water quality surveillance involves the monitoring of drinking water supply by the community at the village level. It comprises the identification and training of 5 women using field test kits, FTKs, that is ASHA worker, Anganwadi worker, teacher, member of village water and sanitation, member of water village and sanitation committee. A total of 26,646 numbers of women have been trained using field testing kits in the state. It also empowers women to undertake water quality testing and uploading of test report by FTK users in JJM WKMIS portal. A total of 11,260 numbers of women have been registered as FTK users. As on that, the local communities are empowered to test their own water samples at least once a year for chemical testing and twice a year for bacteriological testing as per the guidelines of JJM. Any positive results acquired from the presumptive testing at the communities using FTKs will be referred to nearest water testing laboratory for confirmation. Honorable Deputy Speaker, sir, under water quality monitoring and surveillance, as on date, the state has tested 47,165 number of water samples through labs and a total of 16,453 number of water samples tested using FTKs. 5,920 numbers, that is 91.5% of villages are covered for chemical parameters. 3,624 numbers, that is 56.01% were tested for bacteriological parameters pre-monsoon, and 4,975 numbers, that is 76.89% were tested for bacteriological parameters post-monsoon. Covered both through labs and FTKs, 6,071 numbers and 49% number of schools have been tested, and 2,730, that is 54% of Anganwadi centers have been tested. Sir, a total of 5,568 number of villages have been trained using FTKs. 26,646 number of women have been trained, out of which 11,260 women have been registered as FTK users. All the water quality data reported through labs or FTKs are uploaded in Water Quality Management and Information System portal, which is an online JJM, Water Quality Management Information System portal developed for reporting, monitoring, surveillance of supplied water. The water quality monitoring and information system is a one-stop information that has been put up in the public domain, which is made accessible to water sample test results and other details. This will also allow the public to be aware about the water quality information of the supplied water, which can further improve public health. In Meghalaya, the effective operation and maintenance of water supply infrastructure are paramount for ensuring the sustainability and reliability of water services in rural areas. Recognizing this imperative, PHE department has drafted a comprehensive O&M policy tailored to local and regional characteristics, aimed at optimizing the functionality and longevity of water supply schemes. This policy delineates the O&M model, delineates the roles and responsibilities of stakeholders, ensures adequate financing mechanisms, and prioritizes capacity building initiatives. At the heart of the O&M policy is the empowerment of local communities through the village water and sanitation committees. These committees are entrusted with the responsibility of managing and maintaining water supply infrastructure within their respective villages. By decentralizing decision making and fostering community ownership, BWSCs are poised to play a pivotal role in ensuring sustainability of water services. Honorable Deputy Speaker, sir, to finance O&M activities, village and water sanitation committees may be empowered to collect water supply services delivery charges from users. This self-sustaining model not only ensures the availability of funds for routine maintenance but also instills a sense of ownership and accountability among community members. Moreover, the state is exploring innovative financing mechanisms to supplement BWSC funds and ensure the uninterrupted delivery of water services. Challenges. Implementation of JJM in Meghalaya, characterized by unique geographical and socio-economic factors, presents several challenges, some of which are highlighted as impact of COVID-19 pandemic. The launch of JJM coinciding with the COVID-19 pandemic has hindered the planning and execution process. Restrictions on movement disrupted supply chains and manpower slowed down progress in implementing water supply infrastructure projects. B. Land acquisition issues. Meghalaya's land tenure system, where ownership lies with individuals, communities or clans, poses significant challenges for land acquisition necessary for water supply infrastructure. Lack of government control over right of way and the refusal of landowners to grant consent further complicate the process, delaying project timelines. C. Degradation of catchment areas. Anthropogenic activities such as deforestation, mining, urbanization have adversely impacted the catchment areas of springs, rivers and streams. The Meghalaya Protection of Catchment Areas Act 1990 has not been effectively implemented, leading to contamination and turbidity in water sources, particularly during monsoon seasons. D. Geographical and democratic challenges. Meghalaya's rugged terrain, coupled with high number of scattered households across the villages, increases the cost and complexity of implementing water supply schemes. Prolonged monsoon months limit the working season, further constraining project timelines and increasing implementation cost. E. Technical and operational constraints. Challenges such as availability of cost materials like GI pipes, choice between gravity-fed and pumping schemes, and equitable distribution of water supply pose technical and operational hurdles in implementing JJM effectively. F. Capacity building and maintenance. The scale of JJM implementation in Meghalaya highlights capacity gaps in local communities' ability to take over the operation and maintenance of water supply infrastructure. The availability of trained manpower for operation and maintenance remains a challenge, jeopardizing the sustainability of implemented schemes. Addressing these challenges requires a multifaceted approach involving community engagement, innovative technological solutions, policy reforms, capacity building initiatives. Collaborative efforts between government agencies, local communities, civil society organizations, and stakeholders are essential to overcome these obstacles and ensures the successful implementation of JJM in Meghalaya, thereby improving access to safe and sustainable water supply for rural households. Sir, the implementation of Jal Jeevan Mission in rural areas of Meghalaya stands as a remarkable achievement. Early, in the beginning it was 4,550. Now we are 4,80,000 plus. Transforming a landscape of water accessibility significantly involving the lives of rural communities. Despite the challenges such as the COVID-19 pandemic and difficult terrain of the state, public health engineering department's meticulous planning and concerted efforts have resulted in substantial progress. Since the inception of JJM in 2019, the coverage of functional household tap connections has surged from a mere, that is 0.7% to an impressive 74.60%, providing access to safe and reliable drinking water to 4,85,927 rural households. Additionally, water supply has been extended to schools, Anganwadi centers, further enhancing community well-being and reducing the burden on women and children. The transition from public stand post to household tap. Sir, initially when this Jal Jeevan one was started, we were having only public stand post in every villages, which signifies a transition from public stand post to household tap signifies a monumental leap towards ensuring universal access to safe drinking water, significantly alleviating the drudgery faced by the rural inhabitants, especially women and children. This transformative not only improves health outcomes, but also, sir, I'm finishing, only one para. Yeah. Not only improves health outcome, but also frees up valuable time for productive activities, contributing to the socio-economic development of rural communities. Therefore, it is imperative to recognize the remarkable strides made by the state in implementing JJM and focus on sustaining and further enhancing these achievements through continued support by all stakeholders. In light of these substantial achievements and significant contribution of JJM to the social and economic well-being of rural Meghalaya, the proposition of constituting an inquiry commission appears unwarranted and unnecessary. With a coverage of rate 74.60%, Meghalaya has made commendable progress towards achieving the mission's overreaching goal of universal access to safe and reliable water supply schemes. Sir, Honorable Mover of the resolution, Dr. Celestine Lingdo, Honorable Member from Mumsling, has mentioned about few points which I want to highlight. He talked about the Neki Kona scheme. Sir, this Neki Kona scheme was delayed in implementation because in acquiring the necessary plot of land, there was a difficulty in that. That issue got prolonged, and then the procurement of the land was done only few months back, which is why the implementation took some time. Now the project is in full swing. As Honorable Member was mentioning about using of plastic pipes. Sir, these plastic pipes are not normal plastic pipes. These plastic pipes, we call it UPBC, which is approved by the government of Meghalaya, technically approved. So therefore, these pipes are being used, UPBCs. Sir, with regard to Maulai review, which Honorable Member has talked about, it was not a review. Sir, Maulai project was getting delayed because the certain reservoirs were not able to construct for want of land clearance from hetmans and other landowners. So Honorable MDC, he came forward to me and offered this help. So that is why I took a help from the Honorable MDC. Honorable MLA, I would have loved to take the help from Honorable MLA also, but since MDC has come forward and given this help, so I have no other option but to take forward this help, which is why the project is now ongoing. So I don't have any intention to neglect MLAs or to any other member. So in sincere implementation of this Jal Jeevan mission, so need to complete in time-bound manner. So we have to take people who are coming forward and trying to help us in implementation. So only with these few points, sir, I would request honorable member, I tried my level best to address the concerns of honorable member. So with these few words, I request honorable member to withdraw the resolution. Thank you, sir.
Thank you.
Sir.
Very exhaustive reply. So, may I know the mover of the resolution, whether she would like to withdraw or not?
Sir, before the mover withdraws or not, so I'd like to thank the Honorable Minister. Almost 1 hour he took to give his replies. He has given all the statistics. It shows his sincerity in implementing the scheme. The number of blocks, number of villages, population. The only component missing from the data and statistics of the Honorable Minister, sir, is the quantum of water being supplied. He's given his replies numerous times, but we've missed the amount of water that is being supplied. So if that can be given, then it will ensure that the scheme has been successful. He's shown number of household taps that have been connected, number of districts covered, blocks, villages, hamlets. But sir, he's not mentioned the amount of water that is being supplied. So that is the most crucial component of all this scheme. If we have only taps and pipes and the coverage, but then without the water, he's talked about quality of tests being done on the water, but he's not mentioned on the test of the quantity of water being supplied, sir. So that's why, sir, we've requested that if this scheme can be extended, can be reviewed to ensure that the quantum of water that is required to be supplied is supplied, sir. Otherwise, like we said, so this is the, sir, this is the, what I would request the Honorable Minister. I know he's sincere, sir. He took more than 1 hour. He must have taken due diligence. But the only component missing is the quantity, the amount of water that is supplied. That is not mentioned anywhere in his reply, sir. So with these few words, sir, that's why I would request the government, if somehow we miss the deadline, I mean, we cannot, this has to be reviewed, sir. Otherwise, like I said, investment will have been a huge wastage of investments.
Sir, sir, I have, in my reply, I have already mentioned about the quantum of water that will be given to the public. That is 55 LPCD is our target. But unfortunately, because of, we all are aware, because of that drying up of all the sources, it is very difficult in this lean season. But however, since the Honorable Chief Minister has already announced in the August House about the protection of catchment areas, so our target is to give 55 LPCD to all the individuals.
So may I know the minds of the mover of the resolution, whether she would like to withdraw after hearing the reply from the Honorable Minister in charge?
Mr. Deputy Speaker, sir, I would like to express my gratitude for the exhaustive reply given by the Honorable Minister, and I would like to thank him profusely for that. A little clarification, Neki Kona water supply scheme in the portal, it is already shown as functional tap connection. That is why those people went to the court before it is completed. Number two, as per the report given by the minister, overall in the state we have 74.60% of coverage of the JJM. And there is a third-party monitoring entity, that is the TPIAS. I don't know if the minister could share how do we contact that third party so that we can also share our views with them. Having said that, sir, we have a beautiful democracy. I know my resolution will not pass the test of the floor. Voice vote, it will be defeated, but that is in the spirit of democracy. Let them keep the spirit, but let me keep the soul, sir. The soul is, we want a free, fair, unbiased investigation. on the implementation of the JJM in Meghalaya. That is one. Number two, all that I'm asking is water in the taps for the people. How it is tested, whether it is potable or not, that is the duty of the department, but we ask water in the taps. So in view of this, with due respect to everyone, I will be defeated in the voice vote, but I will not withdraw my motion. Because if I withdraw, I run away from my responsibility to speak and demand for water in the taps for the public. Thank you, sir.